The individual mandate, will it stay or will it go?
The individual mandate, that is at the heart of President Barack Obama's health care overhaul.
That individual mandate, is it legal?
The heart of the health care law, the individual mandate will stay in place.
It's just the individual mandate.
The heart of the overhaul, the individual mandate.
So clearly, I'm happy. I'm even wearing my happy yellow dress. I'm happy that the Supreme Court made the right call and held on to its legitimacy. I'm happy that the president will not have an asterisk beside his signature first-term achievement. And most of all, I'm happy that health reform remains fully in place for the millions of Americans who are suffering under our current health care system. But while we are rightly celebrating, let's not forget that there is much more to this bill than a mandate. Since the health care bill passed, Republicans have wanted you to know two things about it. Number one, that it's a socialistic, death panel-y laden, evil mandate that denies you your freedom to not have health care. And number two, that the bill is really, really long. Well, it turns out that in 900 pages, not 2,700 by the way, 900 pages, Congress did manage to say something other than you must buy health care. There are things in there that you might have heard about. Young people can stay on their parents' health insurance and no more copays for preventative care. No dropping people from health insurance just because they get sick. No more hearing the dreaded words, sorry, that's not covered, it's a pre-existing condition. There are things in there that maybe you haven't heard of. There's loans to get nonprofit healthcare co-ops up and running, to increase competition in the healthcare market. Changes in the way that Medicare works to focus on quality rather than quantity. There's even, wait for it, tort reform. So, amongst all these changes that help and protect ordinary people, yes, there is a mandate, albeit one that carries only a small tax, in the Supreme Court's words, and no penalty if that tax is not paid. Look, the mandate is important, but this bill is really not about the mandate. It's about increased competition. It's about controlling rising costs. It's about bringing humanity to a fundamentally broken and inhumane system. Most of all, it's about people like Julie, whose daughter Violet was born with a rare and life-threatening condition. Quoted at Moms Rising, Julie said that unless a cure is found, our daughter will be admitted to the hospital throughout her lifetime, and a lifetime limit on insurance would limit her lifetime on Earth. Now that lifetime limit is gone because of healthcare reform, Violet will live and her parents will sleep easier. Let's move forward and let's continue to improve our healthcare system so that there are fewer human tragedies and fewer people left behind. And let's not forget, it's not about the mandate. So, guys, I'm sure, Essie, you agree with me wholly and completely, right?
It was touching. You care deeply about this, and that is clear.
Thank you.
Crystal clear. And I can appreciate that. I stand by my original statement. This is a $2.6 trillion tax that is going to add to the cost of health care. But I appreciate your passion. I really do.
Well, and I think the point here is everybody agrees that what we have now is broken.
Broken, absolutely.
Everybody's on the same page there. And this is a solution that I don't think is perfect, but I think it's important, and I think it's a building block.
But how could you not mention the Cornhusker kickback?
Or broccoli.
I mean,
that was in the initial draft, but I somehow managed to cut that part out.
When you talk about Julie and you put a human face on it, and we think about the 30 million people who were uninsured until 2014, it really brings it home, and as parents, we're like, wow, that's really important. I do return, however, to Essie's point about, well, if you don't buy in, then you have a penalty, or a tax, but there's no penalty for not paying.
Right.
That is still unanswered. I think Congress is going to have to deal with it.
The example of Massachusetts has been that people want to buy in.
Right.
That's what they find out. You're actually giving people a good deal.
When Romney was governor, right?
Who?
Right. Right. It was his idea.
Yes, for states. Mm-hmm.
All right, guys. Well,
semantics.
Big day today. That was fun.
Your kids are going to be on your insurance until they're 26, you realize.
I have no problem with that.
Yeah, awesome.
Good
for you guys.
All right, that does it for the cycle. Martin, it is all yours.
Thanks so much, Krystal, and thanks to all of you. And thank you for staying with us at this new hour of 4 p.m.